Hi everyone, my name is Rena Rabevsky. I'm the elementary school psychologist at Hebrew Academy, and I'm here with Dr. London, our middle and high school psychologist, and Mrs. Garber, our high school social work intern. We wanted to talk to you today with Nurse Lynn so we can address some of our worries and anxieties that you might be experiencing due to COVID and the new policies that have been put into place as a result. We know that there's been so many changes since the pandemic started, and we wanted you to know that your social and emotional well-being is our top priority. We want to assure you that we are here for you.
It's normal to feel a variety of different feelings from day to day, even hour to hour. If at any time you feel overwhelmed by your feelings, please know that you can reach out to me or Dr. London in the high school, Dr. London in the middle school, or Mrs. Rabevsky in the elementary school.
I remember as a psychology graduate student learning that one of the best ways to help people reduce anxiety and stress is to supply them with really good scientific information. That's exactly why we're here today. We want you to hear directly from a medical professional, our very own Nurse Lynn, who is going to tell you exactly what you need to know about COVID and feeling safe in school. Lynn, take it away.
So what exactly is this COVID virus that we've all been hearing about? Why are we wearing masks, and why are the teachers always telling us to social distance? COVID was identified in Wuhan, China in December 2019, so not very long ago. COVID is caused by a virus, a new, or you may have heard it called a novel virus, which means we have never ever seen it in human beings before, causing respiratory illness, which can spread from person to person. First thought to be only a respiratory virus, it is now known to be multi-symptom, meaning it can attack many of our body symptoms and not just our lungs. So you might be wondering, how is COVID transmitted? COVID-19 is primarily transmitted from person to person through respiratory droplets. That means these droplets are released when someone with COVID-19 sneezes, coughs, or even just talks and sings.
That is why it is so important for all of us to wear masks.
Infectious droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into their lungs. That's why a physical distance of at least 6 feet between persons is suggested by the World Health Organization and the CDC. That's the Center for Disease Control, where we get most of our information to avoid infection. Respiratory droplets can land on hands, objects like our phones, and surfaces around the person when they cough or talk. And people then can become infected with COVID-19 from touching these objects and surfaces with droplets and then touching their eyes, their nose, or their mouth. Recent data suggests that there can be transmission of COVID-19 through droplets of those with just even mild symptoms, or those who don't even feel sick at all. But there is a wide range of symptoms for COVID-19. These include
Fever or chills,
Cough,
Shortness of breath or difficulty breathing,
fatigue or feeling very tired,
headaches,
nasal congestion or runny nose,
muscle or body aches,
sore throat,
new loss of smell or taste,
nausea or vomiting.
diarrhea.
So the estimated incubation period, which means from the time you catch the virus till the time you actually feel sick, is between 2 and 14 days, with an average of about 5 days. It is important to note, as I said before, that some people do not even have symptoms and can feel well even though they have the virus. So there are a number of ways that you can prevent the spread of COVID-19 infection, and we need your help to do so. Some ways to decrease the spread of the virus are: avoid touching your eyes, your nose, and your mouth.
Avoid close contact with people who are sick. Remember that some people without symptoms can still spread the virus.
Stay at home when you are sick.
Cover your cough or sneeze with a tissue and then dispose of it properly.
Physical distance should be at least 6 feet.
Perform hand hygiene with soap and water and use alcohol-based hand rub. Hand rub should contain at least 60% alcohol for those of you who buy your own hand sanitizer. Hand washing should be done for at least 20 seconds.
Use a face covering when physical distancing is difficult or when you're going into closed spaces. It is so important to wear a mask.
Let's talk about the mask for a minute. For it to work, it must cover both your nose and your mouth. The rules in school are, you can only have your mask off if eating or drinking or outside in recess. Even in recess, if you are close to each other, the mask should be on. If you are walking to snack, lunch, or recess, you must have the mask on until you sit down. Here at school, we have an excellent medical committee with 3 doctors who know all about COVID, Rabbi Guttenberg, Rachel Weinberger, Mrs. G. Lehman, and me. We meet all the time, every day, to make sure we are doing the right things to keep you all safe and healthy. You probably know someone, one of your friends maybe, or a teacher who has had COVID and then gotten better. Please know that we as adults make sure that that person is healthy and well before we let them come back to school. Once a student has been admitted back to school, please know that they are safe for you to be around, and we should welcome him or her back into the building without any fear that he or she might still be contagious.
We hope that this helps to ease some of the anxieties that surrounds the coronavirus. Remember that we are all here to help if you have any questions and concerns, so please feel free to reach out if you would like to chat.